Welcome everybody. My name is Maria Rumianceva. I use she, her pronouns. I'm the Associate Coordinator at the National Coalition for a Civil Right to Counsel. We're just immensely thrilled to see so many people joining this webinar today. We're just thrilled that you all are here for the conversation and for the official launch of a new incredible resource, the Advancing Racial and Health Justice Through a Right to Counsel for Tenants. It's a primer for the public health field. We will have a link for the primer ready to go by the end of the webinar today, and it will be sent out in a follow-up email. So you'll see a link appearing in the chat for you all. And Jen, we can get started if you could go to the next slide. So we have the chat open for everyone. If you could just take a moment to introduce yourselves in the chat, maybe list your name, pronouns, location, your org affiliation, and also if you could just add in one thing that you'd like to learn today, that you'd like to discuss today. It's something that we're interested in hearing from all of you. We'll just take a moment to do that and introduce ourselves. Many of you, already over 300 participants here today. Incredible. Next slide, Jen. Great. So I want to take a moment to name the organizations that collaborated and worked on both the primer and the webinar today. This is the result of a lot of love and collaboration between all of these organizations. So we are brought to you today by Change Lab Solutions, Human Impact Partners, Policy Link, the National Coalition for Civil Rights Counsel, and Results for America. And we're so grateful that we're able to have this conversation with you all today. In addition to those orgs, we are also very grateful for our partnership with the American Public Health Association and the de Beaumont Foundation through their Healing Through Policy initiative. And we'll hear a little bit more about that work just coming up in the webinar. And next slide, Jen. Awesome. And so for our speakers today, we have the pleasure of hearing from Brittany Giles Cantrell from the de Beaumont Foundation, Will Dominy from Human Impact Partners. And folks, if you have your camera on, you can wave hey to our participants. Danya Keene from the Yale School of Public Health, Pablo Stupinian from Strategic Actions for a Just Economy, and Melissa Marical-Zayas from Change Lab Solutions. We're so excited to hear from them all, and they have different parts of this webinar, so we're going to go forward to our agenda. And throughout the call today, I just want to have a really quick just point on language throughout the call. So if you hear RTC, what we're talking about is a right to counsel. I'll explain what that means in just a little bit. And we're talking about the right to counsel for tenants specifically. So for our agenda today, I'm going to cover a brief overview of the tenant right to counsel. I'll hand it off to Brittany and Melissa to do some background on right to counsel and public health. And then we're inviting you to a kitchen table conversation with Danya, Pablo, and Will about the public health field and their support of right to counsel policies. We're going to close with some dedicated time for questions and answers. And throughout the presentation, if something pops up and there's a question, pop it into the chat. We're going to be monitoring it. You can also share questions in the Q&A at the bottom. And I see somebody already added their statement there. And so that's also for your use, but we're going to have dedicated time for Q&A at the end. And next slide. All right, so we're going to take off with a very brief, super fast introduction to right to counsel. I want to highlight that if you want to learn more about the right to counsel policies that we're talking about today, I'll just encourage you, the primer that we're sharing is going to include way more detail about this policy and right to counsel laws. And then you could also head to civilrighttocounsel.org which is the National Coalition's website, which has a tenant right to counsel page that has a lot more information and resources for you all. Next slide. So for a quick and broad definition to just get us all on the same page, what we're talking about today is a right to counsel. And a right to counsel is defined as a state or local law that establishes a government-funded guarantee of legal representation in eviction cases or other proceedings as may be set out in the law. And there's a lot of nuances. There's a lot of different parameters when you look at right to counsel laws that exist around the country. But the main point here is we're talking about the right with regard to tenants. So it's tenant right to counsel. Importantly, throughout this conversation, right to counsel laws are essential in our current system of evictions, but they're just one tool. And they're one tool of many that we need to address mass housing instability and the eviction crisis that's happening around the country. Next slide. Just to give a little bit of background, so legal representation for tenants isn't a new concept by any means, but without a right to counsel, it's not a guarantee. And it leaves many tenants who are facing eviction or other displacement proceedings unrepresented. Where studies have been done on the impact of legal representation, represented tenants simply fare better. So represented tenants remain in their homes more often, they pay less in costs, they raise more defenses, and they obtain more time to leave when they have to vacate. Now, when we look at right to counsel laws, those are fairly new. After an immense and years-long campaign, the Right to Counsel Coalition, what comprised of tenants and community organizers and tenant organizers, Pablo was on that campaign. They passed the first right to counsel law in New York City in 2017. And now we have 22 jurisdictions that have codified that right around the country. Again, due to the massive support of tenant organizers and tenants around the country supporting these policies. The latest evaluation shows that 84% of represented households were able to remain in their homes, and past evaluations have shown evidence of changing party behavior. So there have been decreases in filing rates and decreased default rates. In Connecticut, which is a statewide right to counsel passed in 2021, a recent evaluation showed that providers, so the right to counsel providers, have helped clients achieve 64% of all clients' case goals, which include preventing an involuntary move, eviction judgment, and getting 30 or more days to move. There's also a qualitative analysis, but we have one of the co-authors from that study in Connecticut here with us, Danya, and so I'm going to hold off on talking about that. That'll probably appear a little bit in the conversation we're having at the kitchen table. Next slide. And so, as I mentioned, there's 22 jurisdictions that exist as of today. There's 17 cities. They vary in geographic location. They vary in population size. We have one county, Westchester County in New York, and we have 4 states that have codified a right to counsel, statewide right to counsel for tenants facing eviction, either full or a limited basis. So this movement is absolutely due to the swell of housing justice advocacy and organizing that's been happening around the country, and the support of that organizing for this policy. We do expect many others to pass. Civilrighttocounsel.org has all of the legislative tracking of pending bills. And just to close us out, so as this movement grows, we're seeing at the NCCRC that the support of the public health field is incredible in furthering the passage and really truly effective implementation of these laws. Just one example from Massachusetts showed there was a statewide coalition of 20 organizations and members from the public health field who wrote in support of developing a COVID eviction legal health project, which is working its way towards a right to counsel in the state of Massachusetts, but that led to the development of that project. Other examples exist in the primer, and we'll also talk a bit about Connecticut at the kitchen table, as I mentioned. But I am going to stop there. I'm going to pass it off to Brittany to lead us into the healing through policy conversation.
Thank you so much, Maria. And thank you again to everyone who is joining us today for this important conversation. and all the partners that helped to make today possible, as well as the brief. So Maria mentioned, my name is Brittany Giles-Cantrell. I'm a program director at the de Beaumont Foundation. If you're not familiar with us, we are a national health philanthropy working to make sure that public health works for everyone. And we do this by working to advance policies to improve community health, creating practical solutions to support public health departments and their workforces to create better communities, and creating partnerships a lot of times with unlikely allies. And I know there's a lot of different partners here on the call today to really achieve the best possible health and health equity outcomes for communities. So I'm here today in the capacity, obviously, with de Beaumont, but also representing an initiative we lead here at the foundation called Healing Through Policy, Creating Pathways to Racial Justice. So Healing Through Policy was founded in 2021 as a collaboration between our foundation, APHA, and the National Collaborative for Health Equity, and recognition of the, I think at this point, over 250 plus jurisdictions that have made racism as a public health crisis declarations. We believed then, as we do now, that policy, and particularly those have been used to codify structural racism, has produced the health equity challenges that we see in our country. And for communities that view racism as a public health crisis, Healing Through Policy was created to really provide local leaders, not with a checklist of things that you need to do, but options for policies and practices to really move on the continuum from commitment to action for health and racial equity and justice. And so Right to Counsel is one of many policies that we've seen across the country that communities have been getting to adopt, as well as the public health community, to put racism as a public health crisis into action. So we're really happy to collaborate today in this conversation and on the brief. So one, we talk a lot about policy as a path to racial healing and Healing Through Policy. And why is that? It's because I think we all know that in the game of life, policy has literally shaped the house rules we all get to play by, sometimes dictating who gets to play, who gets positioned on a board, who gets to roll the dice, who gets to protect their wealth, and who has their wealth stripped from them. And these policy decisions plays out obviously at an individual level, but it also has generational impacts. And so the same can be said about our health. We have different levels of access to good health depending on policy decisions and communities that have been shaped a lot of the times for us, but not by us. And many of those policies and the related practices and systems that uphold them can sometimes intentionally and unintentionally produce racial differences in health and opportunity. So we know this is particularly true when we talk about the housing crisis, where we know that renters, many of whom are disproportionately from BIPOC communities, who have been cut off from opportunity due to policies like redlining and other policies that have created economic and racial segregation. We know that renters are at higher risk for housing-related health problems, which we'll talk a little bit about later. And all of this is also due to the fact that we have a crisis of unsafe, unstable, and unaffordable housing. So where do we go from here? We really want to think about changing outcomes for communities. We really have to look at the unjust housing policies that have created these inequities and figure out, how do we get policy to work for us? How do we fix policies that have been broken to really position us to be on a path to racial healing? So I think we've all talked about the social determinants of health. You might have heard the term social determinants of health, or SDOH, as we like to say, which broadly speaks to addressing factors that shape how we all live our lives, from our health to where we live, to where we grow, to where we work, to where we age. And in public health, we often talk about addressing the social determinants by moving along a stream of interventions that can ultimately work together to improve health outcomes for most people. So this means we talk about downstream interventions, or meeting individuals through direct clinical care or healthcare needs, to midstream interventions, meaning we're connecting people to direct social supports and other services. But ultimately, what we're trying to get to is upstream. So what are the practices and policies we can put in place to really support community impacts that can allow all people to be healthy? And so I think it's helpful to think about this analogy of moving upstream if we're talking about racism as a public health crisis, as well as how do we use Right to Counsel through this sort of framework. So just to close, I want to paint a picture for us here. So starting at our downstream level, I have a picture of a beautiful young boy here. Let's call him Justin. And Justin's family knows that asthma runs in his family. They're not surprised that he has started to have asthma attacks. But Justin's family has recently moved into a new apartment building, and his asthma attacks have become more frequent. They've become more like he's seeing emergency doctors and going to his doctor's office in a cycle, just all the time, and more so that his family can't even keep up with the bills. So a downstream approach might mean that Justin keeps cycling in and out of clinical care, where clinical care is doing all that they can with what they have, but it's not really solving the problem. Until one day, Justin is able to interact with a social worker who becomes aware of his family and really asks them about their story. And the social worker learns that Justin's case really got worse when they moved into their new apartment building a few months ago, and finds out that his frequent medical visits have been putting a financial strain on the family. So a social worker is doing what they do. They kick into gear. They try to connect his family with rental assistance, utility assistance, food supports, anything they can do to alleviate the financial burden that Justin's health crisis is placing on his family. But ultimately, I think we all know, ultimately in this scenario, everyone is in a cycle of short-term supports. And so everyone in this scenario is really waiting for the last shoe to drop, because nothing here is really sustainable. But what would help is actually having a policy in Justin's community where they could investigate the root causes of his asthma, which is, if we go down the line, really about the mold that is growing in his new apartment. There should be a policy that would provide legal protection for his family to take on their landlord who's trying to evict them without inspecting their housing unit. There should be legal representation that would support Justin's family to either be compensated or thoughtfully rehoused and find healthy housing options. And there should be a policy that would protect Justin, his family, and any other family in their community going through a similar crisis. So this entire example in the story is really an example of why right to counsel laws are needed to really address the upstream systemic factors that are impacting racism, or the phenomenon of racism as a public health crisis. And so we really believe that without policy, we're really creating cycles for individuals and families, entire generations, to be placed in cycles of Band-Aid solutions that perpetuate health and racial inequities. And this is why it's so important that we are all here today. We all have a role to play, and particularly our public health community, our public health departments need to be engaging in policy solutions to fix what policy has broken. And so with that, I really want to hand it over to Melissa to go a little bit deeper into what we can expect from the rest of the call, as well as making these connections to the public health community and right to counsel.
Thank you so much, Brittany. You just go to the next slide. That was such a wonderful introduction and grounding for our discussion today. And hello, everyone. My name is Melissa Marichal-Zayas. I'm an attorney at ChangeLab Solutions. I work with local governments and public health professionals and community organizations as well on addressing those upstream drivers that Brittany was talking about. And prior to my work at ChangeLab, I worked as a housing attorney in the state of Connecticut, where I represented low-income tenants in eviction and housing condition-related cases. And I also worked with community groups on policy advocacy, including the campaign that Maria mentioned to establish a statewide right to counsel for tenants facing eviction. So I'm thrilled to see so many people joining today to talk about this topic and preview some of the concepts and discussion that we get into more detail on in the primer. So the primer is divided generally into two topics. First, we dive in more into the detail of what right to counsel is, how it works, and how it can advance racial and health justice. The second part of the primer offers more information about how public health practitioners, and just to flag for you, we're thinking about public health and public health practitioners in a broad umbrella way. So we talk about all the different ways that individuals that are working in the public health field or on public health can support advancing racial and health justice through right to counsel. supporting that policies and ensuring that they are equitable and ensuring that they're effectively and equitably implemented as well. So just in these few minutes, I will preview some of that information, but I encourage you all to check out the primer itself after the call. Just starting with this slide, I thought it would be helpful to ground a little bit about what why we think eviction and the eviction process is an important upstream focal point, because we know there's a number of upstream points to be thinking about in coordination, and especially when we're talking about housing. So we think eviction is one of those key focal points because it threatens so many of the conditions that we as individuals and as communities need to thrive, right? It impacts housing, but it also impacts employment, education, access to healthcare, our social connections. And in the photo to the right, it shows that during the pandemic, this photo was taken winter of 2021. During the pandemic, we were acutely aware, right, of how important housing was and how immediate and the consequences of eviction can be. And that was even further heightened by the fact that this photo was taken during the middle of a snowstorm. So the community groups and legal aid organizations that I was working with during that time to pass a right to counsel in Connecticut were moved to focus on the topic because of how essential housing is and how much eviction can impact multiple conditions in addition to housing, and how much it can serve as a long-term source of negative health outcomes, as well as impacting the community at large. There's some really interesting recent research that shows that communities where there's high eviction rates, for example, have lower voter turnout. We also know that eviction can impact those social connections and also have a permanent impact on individuals' records. So it can make finding future housing difficult, not just immediately, but also in the long term. So that's just a little bit of thinking about why eviction is a critical focal point. The other thing I want to highlight about eviction that we get into more detail on is that eviction is not just the court case itself. Eviction and the process of eviction impacts the landlord-tenant relationship from the beginning, making it difficult to fully exercise your rights if you know that you may face eviction or retaliatory eviction without having a legal representative to clarify what protections you may or may not have and advocate for you in that situation. And that was something that came up a lot when I was representing tenants and advising them of their rights, is that it's not just when tenants are in the eviction itself that eviction impacts their lives. It's also that the concern over an eviction potentially being filed against them might also dissuade them and discourage them from speaking up about really important issues that might be impacting them, like housing conditions or discrimination that they may be facing. So we can go to the next slide. And then I also just want to highlight that we also know that the impact of eviction doesn't fall on all households equally. Like Brittany was saying, because of structural racism and discrimination, we know that Black renters, especially Black women living with children, are at the greatest risk of having an eviction filed against them, which, again, just want to highlight, jeopardizes their housing in the short term and also can have a long-term impact on their ability to access high-quality housing in the future. And so because of this connection between eviction, the long-term consequences, and the disparities in how this impacts our communities. We then go into more detail in the primer about exactly how Rights Counsel can be supportive. Next slide. So I laid out a lot of context of what's challenging about the eviction process and how it's impacting our communities. And one other important fact to hold in your mind is that right now, across the US on average, there's only about 3% of tenants that have legal representation when they're facing eviction. So that context is important because we know that there's room for improvement. And we also know that eviction cases are something that legal representation can make a huge difference on. As Maria was talking about, we know from evaluations of the Right to Counsel programs that have gone into effect that having legal representation can ensure that many more tenants are able to remain in their homes, and those that do need to move are able to move in a fashion that is on their terms, that they're able to ensure more stability between housing and through that move in a way that isn't sudden and through the force of a marshal. So that the details that we go into further in the primer is thinking about both what that means for Right to Counsel to support housing stability, both in those individual cases and circumstances of giving more people more time to move or preventing the eviction altogether. It also talks in more detail about the connection between an eviction and housing conditions, because oftentimes the root issue in an eviction case can be the defective conditions in the unit. And then we also talk about, again, going into more detail about how Right to Counsel can be empowering to tenants and allow them to have more power to work together, knowing that they do have a right to representation should they face eviction. So next slide. And I just also want to forecast for you. I know that we're short on time, so I won't go into these all right now, but the second half of the primer talks in more detail about how public health practitioners can get involved in working to ensure that these proposed Right to Counsel policies and efforts can be equitable, and how they can actually achieve the goals that I've discussed here. So there's lots of opportunities for different people within the public health field to be playing different roles. But just to say in short that we think it's really important to encourage community leadership, and we think that there's a lot of opportunities to be making the public health case, as has been discussed earlier. Next slide. And on the implementation side, again, we especially thinking at Change Lab Solutions about equitable implementation. Right to Counsel laws are very important in how they actually come into effect, and ensuring that they are fully and equitably implemented is a huge part of the puzzle, and evaluating these programs to know their outcomes is important. So there's, again, additional opportunities for public health practitioners to get involved there. So I will turn it to Will, who will be leading a kitchen table talk, and I think that we'll be able to get into some of these topics a little bit further then. So thank you so much.
Thank you, Melissa. And I want to give a big thank you to Melissa. Can folks make some noise or make a Zoom emoji or something? Melissa really anchored the writing of this brief and has been amazing, has so much knowledge that she shared in that and with you today. So just big thanks to Melissa. And It's great to see everybody today. I frankly didn't expect to see so many people coming together on this topic, and it's amazing to see all your faces. I can't wait to work with you on this moving forward. I'm Will Dominy. I direct the Housing Justice Program at Human Impact Partners, which is a national public health justice organization. And I've had a great pleasure of working with the other brief co-authors on the Right to Counsel and Public Health Sprint that a number of us did a little while ago, and now on this primer. And I come out of work both in governmental public health and then also in organizing and advocacy. And my current role is like a mix of some of those things together. This is the roll up your sleeves part of the webinar. This is like where we're getting into implementation. And we're especially going to focus on two things: the roles that public health can play. And Danya Keene from the Yale School of Public Health is going to help us there. She's done a lot of the research and as well as advocacy around right to counsel and health. And then we'll also be talking about how tenant power fits into right to counsel and health equity. And Pablo Estupiñán from SAGE is going to guide us through and share some of his wisdom from working in both LA, where he is now at SAGE, and then in New York. And Maria and I debated a little bit like what to call this section. And we wanted to keep it formal. We wanted to keep it as like, you know, again, the roll up our sleeves part, and ended with this like idea of a kitchen table. And I wanted to like invite the panelists into my kitchen table. Like, this is my home, like, welcome to my home. I wish I had a cup of coffee that I could hand you. This is my kid in the background. And we're gonna get into it. And as the discussion progresses, we're gonna move from this more formal, or not formal, but like, you know, just with the two panelists, and also open it up for Q&A. So please put your questions in the Q&A box. That's the next thing we're going to get to. And let's talk. So Danya, let's start it off. Can you introduce yourself and just share a little bit of like, what's your role and how have you supported Right to Counsel campaigns?
Sure. Thank you, Will. And I just want to say it's so wonderful to be here with 500 other people. And I've really enjoyed watching all of the networking and connections that's already happening in the chat. So keep it going. It's awesome. So my name is Danya. I'm an associate professor at the Yale School of Public Health, and I direct a research group called the Housing and Health Equity Lab. And I've been doing work on the intersections of housing policy and health equity for almost 20 years. I started doing work on public housing demolition, and then more recently evaluating the impacts of eviction prevention policies like right to counsel. And I think like my interest in this work really began as a way to use housing policy to advance racial health equity, given the like huge role that racist housing policies have played in creating these large inequalities. But over the years of doing this work, I've really come to see that not only is housing policy important for health justice, but public health data and these public health frameworks, these upstream frameworks that Brittany introduced, are really critical and can be really useful for advancing housing justice campaigns, including Right to Counsel. So yeah, you wanted to know how I've supported Right to Counsel. So at my first real engagement with the Right to Counsel campaign in Connecticut, or one of the things I remember, since it was 3 years ago, was when organizers asked my colleague, Annie Harper, and I to write an op-ed about why Right to Counsel was a public health issue, which we did. And I think it's actually linked in the primer. And we also signed this letter that was, it was signed by over 100 health professionals that was presented to the governor about the potential health benefits of Right to Counsel. And I think this was really a deliberate strategy by the organizers to address some of the funding questions. Healthcare is really expensive. Poor health is really expensive. So highlighting some of these health benefits of eviction prevention was one way to address some of the cost effectiveness questions that were going to come up in passing Right to Counsel.
Thank you. How did it go? Like, did it work? Like, when you engaged, you brought this health lens. What was the result?
Well, we have Right to Counsel in Connecticut, statewide Right to Counsel. But yay! I think the health data, those health arguments did play an important role. And in particular, organizers have cited the importance of that letter to the governor. And one of the things I think, drawing on the success of those health narratives in the Right to Counsel campaign, tenant organizers here in Connecticut are now really centering health as a core narrative in this current push to pass just cause protection. So I think, learning from some of the success of that, that health is really important. I think one of the reasons that these health arguments are so effective is it's not just about the money, that health, the economic cost of illness, but I think another thing about this is that these stories about health, they really reveal the immense human suffering that eviction produces. So I think they can bring a lot of people on board with that. And there's really just a lot of qualitative and quantitative data on how significant these health harms are. And over the past few years, even more data has come out. And just one example, just a few weeks ago, our colleagues at Eviction Lab published a new paper in a top medical journal showing this huge impact of evictions or eviction filings, not just eviction, of just the filings on excess mortality during the pandemic. And that paper drew a lot of national attention and really framed eviction as a life or death issue. I think another thing about the health arguments that's really important is that it's not just about, going back to these upstream and thinking beyond individuals to communities. Eviction not only affects the health of the household who is evicted, it has health impacts on families, on networks, and on entire communities. We really saw this during the pandemic when those stronger eviction moratoria were associated with reduced COVID rates for entire communities. And I think Melissa already mentioned evictions, they upset the social fabric of communities, they strain institutions, they have all these community-wide impacts that matter for health. And so I think that's also important to highlight in these campaigns.
Yeah, and I think the pandemic, has been horrible for so many of us for so many different reasons, but I think there is something to take from it. Like, it was almost like a natural experiment of like, what happens when you allow people to stay in their homes and promote housing stability? And I think what we've seen coming out of it is like, when you do that on a mass scale, like, people do better. I think in public health, we so often talk about like how things harm our health. And I think we need to be talking even more about like, what happens when we keep people stably housed is like, we do well. Like, we do well. We should be like shouting that from the rooftops, both about, what we've learned from the pandemic, and then also about things like right to counsel, or just cause eviction, or broader tenant movements. Like, I think we really need to be like doing that. So thanks for your research. That helps us do that.
And one thing about, the saving lives and thinking about the positive, one takeaway from that paper that just came out was not only did a lot of people die because of eviction filings, but so many lives were saved. Like, the data really show how many lives were saved by having these policies in place.
Yeah. So I want to pivot a little bit. One of the things that we cover in the primer is how both individual and collective tenant power is foundational for health equity, really like underpins, to build off what Brittany's talking about, like one of the corest pieces, one of the most upstream things we can be talking about is power. And is that something you've explored in your research or work? And if so, like, what do you think it means for both, like, how right to counsel efforts are led and designed and implemented? Like, what are you taking as a researcher about like when we really think about that kind of upstream work?
Yeah. So one thing that I did as I've done as in the research realm with my colleague Annie Harper and one of our students, Gabriela Vargas, is we did this qualitative evaluation of right to counsel in Connecticut, where we spoke with 100 stakeholders, tenants, landlords, service providers, legal aid attorneys. And power was certainly part of a question we had in that work. And, one question that we had going into that study was whether we could, whether right to counsel could not only support the health of individual clients, not just the person who's going to be protected from getting evicted, but have health benefits for tenants more broadly as a population. And one of the examples, one of the ways we were thinking about this is if right to counsel could reduce landlords' power to retaliate when tenants challenge those health harming defective housing conditions that are so prevalent. I've seen people in the chat talking about them. And I will say that we don't see like a ton of evidence that right to counsel alone can do this. Here in Connecticut, we have a severe lack of affordable housing, existing landlord-tenant laws. These create substantial power imbalances. And tenants, participants in our study talk about how they don't, some people talk about not wanting to rock the boat with their landlords because there are few alternative housing options available. So I think right to counsel alone is kind of limited, but we do see a a lot of potential for Right to Counsel to support tenant organizing and efforts to move towards those broader changes that are needed. So I think about the health impacts. Like Right to Counsel is going to have substantial health benefits for those individual tenants who receive really critical support when they're navigating a fundamentally unjust system. But I think the broader health potential of Right to Counsel is in the way that it can operate as a tool or as a step in really transforming these unjust systems that are at the root, kind of the top of the stream that Brittany showed. Because it's not just eviction, like people who are paying too much for rent, people who are living with this constant threat of eviction, people who are working multiple jobs to pay their rent, like all of that, and communities that are having a lot of displacement and turnover, all these things are bad for health. So I think, getting to those the top of that stream is really critical, and Right to Counsel can play a role in that, but may not be able to do it alone.
Thank you so much, Tanya. I think that's really compelling. I want to encourage you to drop your mic, and we'll come back to you. But I want to move over to Pablo. So you've played a really central role in a bunch of these campaigns, and I want to hear, both introduce yourself and the roles that you played, and then also how do you think about the role of tenant organizing and movement building in both Right to Counsel and then also broader housing justice movements, right? Like we heard from Danya, yeah, Right to Counsel's maybe a necessary, but not it's not everything as part of those movements. So can you share your perspective?
Definitely. Hi, everyone. My name is Pablo Stupinian. I go by he, him. I work at SAGE currently, Strategic Actions for Just Economy here in Los Angeles. I'm currently the campaign director for the LA Right to Counsel Coalition. Previously, I used to be the interim coalition coordinator for the New York City Right to Counsel Coalition and was on the steering committee for a few years. And back when I started my career as an organizer in 2013, I started to work in the Bronx Housing Court and also on the Right to Counsel campaign. So I've worn plenty of different hats throughout the last decade and working on Right to Counsel. And thanks, Will, for that. And, I think tenant power is critical and central to building a movement to win Right to Counsel. And I think to Danya's point is Right to Counsel is one of the tools in our toolbox. We need many protections because tenants aren't just facing evictions, they're also facing, for enforcing their rights around repairs, habitability, when they have leaks, molds, landlords may retaliate. So here often at SAGE, we have tenants come in and they're facing all of these things, right? They need repairs, they have mold, it just rained really hard. So there's leaks. And because they called the Los Angeles Housing Department, the landlord retaliates, and there's almost no, even though we have an anti-harassment ordinance, it's very weak and not enforceable. And at the same time, they'll get that unlawful detainer, right? So it's a lot for folks to go through. And those are all connections. So not only do we need Right to Counsel, we need other tenant protections. I'd like to share a little bit more about how we were able to do that in New York City. But going back to the role of tenant leadership as being really crucial, it was put into practice in the New York City Right to Counsel campaign. So in 2013, we're going back to the Southwest Bronx where I used to organize at CASA, Community Action for Safe Apartments. We were just asking, our members in the Bronx, what are you facing? And almost everyone said eviction. Either they were going through Bronx Housing Court or knew someone who was about to get evicted. So, members voted to start this campaign. We didn't realize it would end in Right to Counsel, but we spent a year training Bronx community members on the housing court system to understand it. We trained the Bronx members to do surveys. We ended up publishing a report called Tipping the Scales in the fall of 2013, which led to the foundation of the New York City Right to Counsel Coalition in 2014. So as y'all can see right from the start, tenants were very core to the campaign. They decided on a campaign, they carried out the work, helped do the research, and then helped come up with the policies. There's a list of over 20 recommendations around just, housing court is, it's a whole other conversation about how intimidating and confusing it is for non-attorneys to go there and defend themselves. But at the same time, the report, the main thing was the game changer would be Right to Counsel, right? Tenants being represented would change their outcomes drastically. And that in terms of what folks have been talking about also change public health outcomes, right? So another thing I wanted to highlight was, right from the start, tenant leaders were there. And when the coalition was formed, a steering committee was also formed, which included tenant leaders, organizers, and lawyers. So right there, we're putting this tenants in the driver's seat. They're helping make decisions on the campaign. overall strategy. They're talking to press conferences. A lot of the tenant leaders were talking, we had to convince 51 New York City council members to sign on to the bill. We ended up getting like 37, which was the majority. And there's also so many community board presentations. So just get the support of the community members and just, to support the right to counsel. So the next thing I wanted to share was, winning right to counsel in 2017 was historic, right? New York City became the first city. It kind of helped spark a larger movement as y'all are here and part of this. It's amazing to see so many of you and 500 folks here. At the same time, I think it helped lay the foundation for a larger tenant movement in New York State. As organizers, we're taught to dream big, ask for the impossible. And I think actually winning right to counsel helped us take that more seriously. Like, oh, we can win. We now have the power to do more. And I think that, that allowed us to win other protections. So I don't think without winning right to counsel, I'm not sure we would have time.
No, you're okay. I mean, I want to
Okay.
ask you another question, but yeah, you're great.
Okay. I'm almost done. So with this part, I think we laid the foundation to being able to win some of the strongest rent laws in 2019 in New York State. So, we expanded our power beyond the city. Statewide housing coalition formed in 2018. We won these rent laws in 2019. And then the pandemic happened, right? And so New York we were able to organize, mobilize for one of the strongest eviction moratoriums. And in the, after we won right to counsel, the coalition kind of focused long term, like how do we just make our communities eviction free? And that was a reality during the pandemic. In the first 18 months of the pandemic in New York State or New York City, less than 50 evictions were carried out. So we've really halted the court system. We brought it down to a close, and we showed that, the bigger goal of really just stopping evictions in general was possible.
Thanks, Pablo. I'm curious, like, was public health involved in any of the campaigns? I know Sage does sometimes do work with a health lens. Like, how have you seen health, either in right to counsel or in kind of the broader work? Or have you?
And being in this webinar with y'all, I think it's been a missed opportunity for us as organizers. So I haven't personally in New York City worked with public health folks, but I think here in Los Angeles, there's lots of opportunity. We do have a promotores program. So down the street from Sage, there is Esperanza, and we often make referrals to each other, right? If we have tenants coming in with a public health, like a mold issue, that's really a public health agency, we refer them to them. So there's a lot of, I think, opportunities for collaboration. We're kind of both doing the same work, right? In terms of reaching out to tenants and, housing issues like high rents, repairs, everything that's been mentioned is happening. Yeah.
Yeah, I think when I made a transition from working in more like environmental justice work and organizing advocacy kind of stuff to public health, it was actually a really natural transition because there's frameworks in both worlds that are like people should have what they need. Like it's that simple, like people should have what they need, right? And so I do think there's lots of room for collaboration across the sectors. Melissa, I saw you with your hand up, and I think this is actually a great time to start expanding the panel.
No, that was actually an accident, but
Oh.
but I think that I just love this conversation. So just keep it going.
Okay, great. Well, I wanted to add like one more facet. I saw a number of governmental public health people on the panel. And just to say, like public health is a really broad field, right? We've got academics like Danya, we've got people who are working much more at the community level, we've got like policy advocacy people, and we've got a lot of people who are working like within governmental public health departments. And I'm wondering if anybody who's on the webinar who works in governmental public health, could you raise your hand if you're willing to be like, hey, here's how I see this, like potentially connecting with my work. I know that's a big ask in front of 500 people, but anybody willing to share? It could be just like, what do you dream of? Like, what could it look like? I'm not actually total. Okay, so I think I see some hands up, but I can't see you. Policy, like I'm wondering if you can kind of call on somebody. Or if you have your hand up, just come off mute.
We can let Diana?
Oh, I'm sorry. I may have mistakenly raised my hand. I was meant to do that. Sorry.
All good, Diana. Maybe Lisa Miller, hear from you.
Yeah, I was just typing into the chat. So I think I see this tying in closely with our lead poisoning prevention work because we were working with families who are at risk for retaliation when they have either triggered a preventive inspection or a case with a child with an elevated blood level. You know, in either way, oftentimes the landlord's looking for a way to not have to deal with that whole problem. So that's where I see the closest tie-in for us.
Thank you, Lisa. That's super helpful. And one more, maybe, Jasmine, if there's someone else.
Sure, let's hear from Adam Torres. If you're available. Not, let's hear from Jamie Bell.
I'm sorry. What did you want?
If you had anything to share about governmental public health roles, but maybe you have your hand up just from something previously.
I didn't mean to have my hand up. Sorry about that.
Okay, great. Okay, well, let's move on, I think then. Melissa, did you have something to add?
I was just gonna chime in that encourage you all to check out the in the second half of the primer that we include some recommendations, and just to flag that that governmental public health folks can be helpful both in policy development and also on the implementation side, especially with the connection between housing conditions and eviction and code enforcement, making sure all those systems are linking up and at the right time to ensure that people stay in their homes and in healthy homes is really important, and there's lots of opportunity there.
Yeah, and I would just add from my experience in governmental public health, like I often thought about, you know, in volleyball, there's like the person that shoots the ball up in the air and then someone else like spikes it over the net. Like I think governmental public health in particular can have a big role in the like putting the ball up in the air thing, like supply the data, make some of the cases, do the kind of research that Danya's doing, like really make the case of like, what are the impacts that we're seeing in our communities? And sometimes, like depending on where you work, like you can actually then go up and have the health officer testify or someone else testify, but like that's not possible in every jurisdiction. And where it's not, you can still, I think, be really helpful in making the case and leveraging and lending some of your institutional power to be like, this is a real issue. And other people have some great ideas about how to get it over the finish line. So, you know, where you can advocate, please do. A lot of folks can, and when you can't, I urge you to think about volleyball. Okay, so let's, yeah, go for it, Brittany.
Yeah, I was two hands to what you just said, and I also just want to say on the data point, but it's also the narrative change point, because I think
Yes.
a lot of us aren't connected because, to your point, Will, like we're all saying the same thing and not realizing that we are. So I think we all kind of need to start speaking from the same playbook and using the same language about how we're describing health across our sectors, how we're describing policy across our sectors, and the role of systems within systems for contributing to both the adoption and the implementation of policy, and how everyone has a unique role to play and unique assets to put it to bear.
Thank you, Brittany. Okay, so I want to take maybe just like one or two audience questions. One of the, beyond what we've covered, I think one of the ones I'm seeing is like, what are the intersection points, or how do we think about intersectionality here around gender justice, around disability justice, around folks, around LGBTQIA people, about reparations? Like, does any of my co-authors want to like join on the like, okay, how are we thinking intersectionally here? Like Jasmine, Brittany, Melissa, or Pablo, anyone really.
I'll chime in. The one thing to add is in different jurisdictions, we have different protections against discrimination, right? A lot of those protections are not enforceable without, you know, are created as a back end in protection. So it might be that you're not supposed to be allowed to get evicted if there's discrimination involved. But in many cases, that requires a legal argument to be made in a specific legal process. So there's a lot of opportunity to think about how do we make those arguments, how do we get them before courts, and that sometimes is going to require attorneys. But we also can be thinking about how to make those protections real and also inform individuals about what their protections are so that they can be empowered.
Danya, I'm seeing you raise your hand.
Yeah, I was just gonna add to that, that one of the things we've been hearing and doing interviews around the country about right to counsel is that one of the things that it does by bringing tenants legal representation in their eviction cases, rather than eviction being decided by default, where none of these issues, none of these discrimination issues get to come to the surface, having lawyers in can help bring out all the complexities of eviction cases, which include discrimination, and also lead and other housing issues. And so part of it's making the unjust system more visible by not allowing it to happen by default.
Pablo, I maybe saw you looking to respond. Did you have something here? Okay, great.
No, I'm sorry, it's my coworker.
That's okay. Okay, so I think we're actually going to move there to next steps, and I'm going to turn it over to Jasmine.
Yeah, thank you all so much. Hi, everyone. It was so great to be here with you all this afternoon or morning, depending on what coast you're in or where you are today. My name is Jasmine Ringel. I'm a senior associate on the housing team here at PolicyLink, and we were so excited to put this on. If we could get back to the slides, that would be great. But I just want to give a huge shout out and thank you to our wonderful PolicyLink web administrator here that helped us put on this webinar. We had over 1,200 registrants for this session, which is incredible. You all broke a PolicyLink record, which is awesome. It just goes to show how deeply our communities need these real impactful and transformational solutions and need broad coalitions in order to pass them. Again, I want to thank Melissa from ChangeLab Solutions for all of your hard work leading the draft of the brief and the primer and bringing up this opportunity with all of these partners together. I'd also like to give a huge shout out to the whole crew that worked on this brief, ChangeLab Solutions, Human Impact Partners, the National Coalition for a Civil Right to Counsel, Results for America, and the housing team at PolicyLink for developing the brief and the ideas behind it as a part of the Advancing Racial and Health Justice Right to Counsel sprint. And then finally, I'd love to also thank the de Beaumont Foundation and the American Public Health Association for partnering with us on this brief, the sprint, and the broader work of winning racial equity, housing, and health justice through the Healing Through Policy initiative. So with that, I know we had promised for a long time, I would love to send the brief to you all. Please feel free to read at your, thanks, Will. Read at your leisure, share it with your networks, discuss it with your colleagues, all of those sorts, and just start thinking of the ways that public health can continue to be integrated into all facets of our housing work or just our work in general. Just a quick note that Public Health Week is also happening between April 1st and through April 7th. So be on the lookout for more opportunities to learn about public health and right to counsel that week. And on another note of more resources to come, of more right to counsel resources to come, Results for America's Economic Mobility Catalog will be publishing a snapshot implementation support resource on a right to counsel for tenants. So be on the lookout for that. With that, a lot of questions were put in the chat on follow-up. We will be providing a recording to this webinar and the slides, as well as additional resources that get to a lot of the questions that were asked in the chat regarding funding or regarding specific policy areas or design pieces for a right to counsel. So we'll be following up with those pieces. But I would also love if you all could help us improve the content that we give you all by taking this quick survey. I hope that you all can provide us some kind of feedback, what worked well for you, what didn't. Just let us know how we could do better, or any future support that you might need help on. So with that, thank you all so much for your time. We hope you have a great rest of the week.